I'm Dr. Wolf with Vitality Specific Chiropractic in Seattle, Washington, and today we have one of our patients, Lauren, with us. And Lauren, welcome. Go ahead and tell us what was life like for you prior to coming here, and maybe also elaborate on how you found us.
Okay, what life was like before I came? Hard. I've been struggling for several years to pinpoint the cause of my inner ear disorder. I was told by medical doctors that I would have to live with it and manage it for the rest of my life.
What was the clinical term for that inner ear disorder?
Endolymphatic hydrops, or Meniere's disease, known as a degenerative and incurable disorder. So life was hard, and I was struggling, and I was looking for a solution. I was looking for relief for myself and my family. I exhausted all medical avenues as far as I could tell.
Right.
And I found you on Google.
Right.
I found a hearing loss forum that referenced a study written by an upper cervical chiropractor in 1998 that said that a lot of people with Meniere's disease had this upper cervical misalignment, the top two bones of the spine that hold your skull and turn your head.
Fascinating. Okay, so then you came to our office through that avenue. What occurred when you came here? Like, what did we do for you? And then what has life like been since we began that treatment?
Okay, so the first step is you come in, you get your measurements taken, you get some very specific x-rays taken of your upper spine and your head. Then those are looked at, and you're kind of given a treatment plan and kind of told what's going on with your neck. And I came to find out that I did have this rare upper spine misalignment that all the other Meniere's patients had.
Yeah. It's called a primary subluxation.
Yeah.
Clinical term, right? So what was the adjustment or the procedure like?
Okay, so measurements, x-rays, and then for the second appointment, a very, very specific, very gentle correction. At first, when Dr. Benlin gave me the adjustment, I did not think that it had happened.
Yeah.
I didn't think anything had occurred. And I laid down for the 20 minutes, and during those 20 minutes, I began to feel sensations, warmth, tingling up the sides of my head, and it just progressed from there into wonderful feelings. Within a few days, I had less dizziness, less pressure, less pain, less nausea, and it just got better and better as time went on, as the treatment progressed.
Excellent. So as of today, now things are doing much better, of course, and this has been, how long has it been? A few months?
9 or 10 months.
9 or 10 months, okay.
Yeah.
Maybe just touch a little bit on what was, like, where were you at or in your life, around the, like, where you're at with your health. I know that getting and talking to you a little bit, there was, the light word I use for you is despair, for where you're at. So what was your hope prior to getting this care?
Based on what I was told by my medical doctors, I did not have a very good prognosis for my future. Multiple doctors told me that there was no known cause of this, that I would have to learn to live with it, that I would need to take medication, and have a low salt diet, amongst other things, for the rest of my life. And I was 33,
Right.
and I had 2 small kids.
Okay. So how do you see your life going forward now that you've gotten under upper cervical chiropractic care and
I know a big buzzword here for you guys is hope.
Yeah.
I did not have hope when I came here. I'll be honest. I was pretty wrung out. You guys gave me care, like real compassion, and you gave me hope. And it's unbelievable. I just, I feel like I'm in charge of my health and my life again, my body. I feel like I can come here and you guys will help me. And I know you'll help me because I have the results. I can live my life now.
Right. And we know that because you referred us a bunch of people already too, right?
Yes.
Yeah.
I want everyone with Meniere's to know that they do not have to live with it. If you've had it for 30 years, if you've had it for 5 months, you do not need to live with Meniere's disease. You do not need to. And there's hope, there's help, and upper cervical chiropractic needs to be more widely known. And I wish, and I hope, and I pray that that is the first place people go in the future, rather than to the medical community.
So do we. So, well, great. Well, thank you for coming today. We really appreciate it.
Thank you.
And we continue to have hope for you.
Thank
All right,
you.
thanks.